going to record it. Okay. Before we get started today, I just want to give a land acknowledgement that while we meet today on a virtual platform, we want to take a moment to acknowledge the importance of the land which we each call home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. From coast to coast to coast, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nation people that call this land home. And so credits for the slide actually go to Melissa, and the website linked here, www.natives-land.ca, is where you can actually go to see, and this is across Canada, and I think Melissa, you had said it's actually beyond Canada too, where you, sorry, I can't speak today, where you are located and what the native land of that place is. So if people wanted to share in the chat as where you're calling in from or zooming in from today, that would be really awesome. And with that, I'm going to also briefly introduce our panelists here today. We have Michelle the Irish, Melissa Fernandez, and Nicole Roy, who will be speaking to the various very cool, very amazing things that their campuses are doing. Okay, and with that, I'm going to turn it to Nicole.
Good afternoon, everyone. Welcome. Can you hear me okay? Awesome. It's a little echoey in here. I'm moving into my new office, so I am here right on campus today with you from Timmins, our Timmins campus from Northern College. I just want to start by thanking all the participants for tuning in to hear what we have to say and share. I'm excited to do so. And also want to thank, of course, the Center of Innovation for inviting me, not so much to represent the North, but to come in with a Northern perspective, so to speak. And as well, thanks to my co-facilitators today, Michelle and Melissa. Thanks for your organization and putting these slides together. I think we put something very cohesive in terms of a presentation for all of our participants. You can go on to the next slide, and I'm going to start by there you go. Just by also acknowledging today being Orange Shirt Day. So, you know, Northern College, I just kind of took a little snapshot off of our webpage and how we share a story, one of many stories about residential schools. So if you do want to take a look and click on the link or check out the link later, I can put it in the chat box for you. But I also wanted to pay a little tribute on this day by sharing that I recognize and I'm aware of my own colonial privileges. And want to continue by sharing these types of messages in honor of the truth and reconciliation. So Canada's history, of course, in our education system truly requires our attention. So thanks for the opportunity. I got my orange shirt on and my button ready and to represent the day. Next slide, and I'll start with, before I get into this, talking a little bit about Northern College. So some fun facts. First of all, we are, I think, the smallest college in the system with just under 2,000 students, which gives us some advantages and opportunities to be creative, of course. So one of the advantages that we highlight a lot is that we get to really truly know our students, which has of course been tested in this time of COVID. So I come to you again from our Timmins campus as part of a collective student services, which you see listed here on our slides. We are different from counseling services, so I'll talk a little bit about that. But like all post-secondary institutions right across Ontario and beyond, you know, we all moved really quickly to this online virtual platforms. You know, we thought that we were well positioned and understood, you know, online learning, having been, you know, a remote institution and producing courses right across But, like many were learning, we thought we were doing all the right things from, that immediate transfer to virtual, both education and support, administration, producing, we have, I don't know about your institutions, but we have a, multitude of, we have Zoom and MS Teams and Blackboard Collaborate, Adobe Connect, all of these different things. So we're learning, we have these things, but how do we make them work for the best for everybody? We communicate, we enhance communication, we re-communicate because things are so fluid. And then, we have different programs like, setting up a quarantine support system within our own residence and so on and so forth. We've even moved one of our campuses to become a field hospital in support of provincial support around COVID. So like I said, we are still learning. So a lot of what I have to share with you is a part of our planning and not so much production yet. So we're learning. Things are evolving. So as they evolve, we adapt and change. So just a little bit about, and if I go over my time, someone just wave me down because I tend to ramble on. I wanted to promote our model of service, and I will be sharing a lot of our things from that perspective. And I know that I think it's Melissa who has like an amazing presentation on support in the classroom, in the virtual classroom. So I'll leave a lot of that to her. But our advising services at Northern basically is a very non-clinical type of support. So we have, it features an open door policy. So we have these 6 different areas of expertise, if you would, advising services. So they are professional, skilled, non-clinical type support staff. We've never had a counseling service, I think, in the last 20 years at Northern College. So we've really moved from that model, and we work very closely with our community partners with referral services for healthcare treatment, including mental health care treatment. So I don't know if we're unique in that sense, but I think that it does separate our services from a lot of what's out there. So we have multiple staff with cross responsibilities that allow for virtually 0 wait time. And I mean that in both respects too. When we were working on campus, I think the most I've ever seen a student wait was about 10 minutes for our services. So access, really, really important. And now as we move into a virtual world, we're learning about how to reach and meet that need as well. So we have an incredible connection between our departments, various campus services, community-based organization, in order to optimize the relevant expert help for students. And so I sat down and I tried to pull keywords so I wouldn't bombard you, but just sort of an overview of what each of these expert or disciplines take care of on campus. So they range right across the board. So my role in campus mental health is a new role at Northern College, which I'm super proud of our institution for taking this on. And I know many are in terms of student support. So it's a part of this comprehensive team advising services. So again, non-clinical responsibilities right across all 4 of our campuses, which are in Timmins, Kirkland Lake, Hillbury, and Moosonee. To support one-on-one, and now of course looking at supporting one-on-one virtually. Promotion, awareness, I facilitate and organize training, so I'm an instructor for Mental Health First Aid Canada, and then I'm also responsible for developing community-based partnerships and to implement the components of our newly developed strategy, all of which was supported by the Center of Innovation and Campus Mental Health. Next slide, Perlin. So here are just some of our highlighted, I guess, methods or activities for engaging our students. So we wanted to find some fun ways. We typically pride ourselves on, again, walking down the hallway, knowing our students' names. They come to us, it becomes quite a family, which we do reflect to be the Northern experience. And there's one of the advantages of being a small institution. So we came up with some of these things are old, of course, strategies or ways to engage, but moving to a virtual platform. And then some of them are new based on new trends, so on and so forth. But at Northern, essentially everybody recognizes that mental health is, a collective responsibility from staff to students alike. So all of these activities listed here on this screen essentially come from various aspects. So they're not just my responsibility or in our team, but right across our campuses. So in all the work that we do, we've really wanted to produce a culture where mental health is always on mind. And we recognize that, just because we're running, an orientation doesn't necessarily mean, oh, that's a mental health initiative. But surely the way, the strategy, the attitude, the culture you produce in an orientation will contribute to positive mental health, of course. So we have, mood boost Mondays, for example. Well, we're going to open up a virtual platform, invite students in via Zoom or MS Teams, whatever it might be, to come in and, see or hear some, an inspirational quote that day, or maybe we just send it out by email. We have some pretty creative staff who designed this Northern Perk, which is an open forum, another way of maintaining that open door policy for our services. So it's an open link to join us via MS Teams. And Perk is a little play on a bonus, as well as a little coffee house to come join us just to chit chat about this, that, and the other. And they've also associated it with the Friends theme, so like Central Perk. And then we showed up in our virtual orientation with our advising shirts that say advising in the font, "Don't tell friends," from our Friends show. So peer mentoring, peer tutoring, of course, just taking a flip over to the virtual world. Our learning strategist within our accessibility team, assistive technology. Obviously with tech, we're able to do things remotely pretty easily when the technology works. Our student government is getting really creative, and I'll talk a little bit about that after in terms of how they're engaging students. We have Thrilling Thursdays where we bring in Zumba and some fun activities, maybe linking physical health to your mental health. Webinar Wednesdays, complementing your academic learning, but also complementing your own personal achievements and goals through some wellness strategies and workshops. We look to even bring in some of the experts from the outside from our local CMHA or counseling centers. And then our cultural sessions too are moving online, and they have some wonderful ideas, making Bannock on video and doing different things that way. The student success strategy is another, it's not new, but some of the things that we're doing that are new are really, really cool. So I'll share a little bit about that too. Smoke Signals comes from our Indigenous advisor, who sends out sort of like a listserv to our Indigenous students who have identified and look to have that additional support. And then we've also done some really cool virtual orientations, like Navigating Northern, where we'll just produce some live videos hourly here and there on various topics around student services and academics and processes and how we're keeping our environment and our campus community safe. That's a lot. So what I thought I'd do, if you move on to the next slide, is sort of present how we're looking at implementing plans and changes with regard to mental health in the context of a global pandemic. So, and part of my responsibility is to work within all of these focus areas, these priority areas, which was adapted in a Northern College as part of our mental health strategy, but driven by the post-secondary guide to a systemic approach, of course. So all evidence-based focus areas. So we look at all of our plans and our current strategies with now a virtual lens coupled with that mental health lens, coupled with the virtual or the global pandemic lens. So we're just sort of re-looking at all of these areas and utilizing the principles behind planning for them with all of that outlook. So I'll go through each of them really quickly just to share some of the things that we're up to within each of them, but as well as just the guiding thoughts behind them. So the first one on the next slide is planning and policy. So, we know that planning and policy is obviously a priority. We're guided a lot by our public health to implement new ways, but from more within, we look to different research on impacts related to virtual learning and mental health, which is, there's a lot of stuff out there, but of course that is also very fluid. We think about the demands, the stresses, new responsibilities, the costs, coping, and supportive techniques that could be involved in developing or adapting or removing policy. We look for flexibility. I think Chris in our little chat before was talking about, the need to even adapt your policy around due dates for, bringing in assignments, for example, because, we're that kind, but also because we recognize technology is not perfect. So, and like many, we've produced policy around pandemic responses, what to do if, what to do in the meantime. We built in communication structures on our website about safety, about health and mental health and sort of a holistic view. And, hearing from messages right from our president to staff, our president to students, and our deans and our support systems to students, also taking on a new look as well. So I wanted to talk a little bit more about the student success strategy here, where we've developed this new method to, recognize when a student might be in a little bit of distress in a virtual world. So we've developed a database internally to collect periodically and timed from our faculty any concerns they might have. And so that's just automated into an email to our academic success advisor, who will then respond to the faculty as well as the student as a follow-up. And I realize this is not new to many, but it was a new process for us. And because it's built into this database, completely relevant for today's world and working from home and making it easy to do. And so our next steps now are to, build that capacity with our staff to recognize the distress in that virtual world, which has to couple it. The next slide talks a little bit about mental health awareness. And I like to, suggest that education is our aptitude. We can't underestimate the challenges, of this pandemic and what it's doing to our mental health. We can't underestimate that. We have to understand the macro and micro levels of these impacts, the concerns students have, and that we should also have in terms of employment opportunities and those micro level stressors, like, getting assignments in because of, and having children at home and, having to get out to get groceries, for example. All of these add up at a different level. And so with awareness, we want to enhance and not increase promotion. So I bring the example about, I'm working from home and I feel like I have to do things. So I'm constantly online and I'm promoting and I'm sharing and I'm sending out information to students until I see an email come back that says, too many mental health emails detrimental to my mental health. And I'm like, oh crap, right? So just being cognizant in what I'm sending out and how often I'm sending out is really, really key. So getting creative with what goes out there. So here we look to also build our partnerships with our community organizations and our other campuses and institutions across the board to learn best practices. We reintroduce our campus and advising services for our faculty as well. So recognizing that awareness and promotion doesn't just happen between students, but also within, and sort of reintroducing what we do and how we do it and that communication. At the end, I have a slide where I mention that it's time to get creative. Really, I speak to the fact that there's so many opportunities out there for bringing in the right type of awareness, through multiple channels from multiple areas in our province. We have national programs that are producing things that are really, really well done. The Center of Innovation, sending out tip sheets and toolkits and evaluation opportunities. So we get creative with utilizing those and really using them. I mean, people are developing them just for us. It's phenomenal. Next, we have, building that supportive climate. We've produced, like I said, the virtual live orientations with intentions to offer that real-time, you can switch to the next slide, Perlin, real-time introduction. So we really wanted to truly foster that that connection. So instead of, creating, for example, a pre-recorded orientation or uploading modules, we just opened it up, and it was so well received to this virtual live orientation. The comments that were coming through, really creating community, was a good kickoff. It was extraordinary in our end. And the worst thing that happened was that we'd maxed out MS Teams, recognizing afterward that it only held capacity for 300, which I know is not a problem for the rest, but certainly for us, we didn't realize we would blow that up. So, we want to create those positive connections. It's never been more important. Institutional commitment, service design, always, of course, recognizing that it could foster or hinder the connection. So we're mindful of all these live opportunities to engage. We think about our international students and how they're, oceans away and have different time zones. And, we have staff who are willing to get up early to open up these platforms so that we get them, engaged in a time that's suitable. And then in this part, I think you'll hear some really good key messages from Melissa from the U of T. With regard to creating that virtual space and kindness, and you can go on, that's okay, next slide. So building our capacity, speaks to developing our staff, our environment, our culture that way. We follow a lot of what is offered out there, like I said, with the Center of Innovation, that's even COVID specific, producing this upcoming conference on bright futures. We're really active as an institution with what they produce. We attend all the forums for the North, and the webinars like today, I share them out for all of our staff to build their own capacity at their leisure, as well as campaigns that are produced, such as, the back to school media kits. I mean, gobble it up, folks. There's nothing better out there, I promise. Training for staff, we do our best. We're super excited about the Mental Health Commission of Canada moving mental health first aid into a virtual platform. Yay. I don't know if we have any reps on site today, but just got the notice about that. And that here we must recognize that the true real learning about, in terms of building our capacity, comes from the student. Next slide really has to do with, developing the students. So we talked about developing the staff. Here we develop the student and offer all of the opportunities to develop coping and self-management skills. And we know there's studies out there, and students are screaming and barking about work-life balance. And, just think about that coupled with the stressors of a global pandemic and going to school, it's becoming a little harder. So, what are their new demands and how do we support them is a question right now. So we look to, encourage offline challenges as part of our strategy here, and recognizing students are online sometimes for 4, 8, 9, 10 hours a day. So to, send out a workshop for an hour on that day they've been in class for 10 hours might be just a little too hard pressed, of course. So perhaps building in some opportunities to get them offline could be a really good strategy. We offer for this, various leadership opportunities. There's a lot of stuff built in with regard to, becoming a mental health ambassador. We have our JAC chapter on campus. We promote Real Campus, which is our student health benefit course. Or not our course, our health benefit package, which, has all kinds of things to share out. So we know students are going to go dig in and find things, but I do, and I go pull out various relevant information and share it over to students to help with building that capacity. We partnered with CMHA and other projects to develop custom-made training, and we're looking to do that again. So once upon a time, in the very beginnings of the Mental Health Innovation Fund, which was what gave birth to the Center of Innovation and Campus Mental Health and many other projects across the province, we had the opportunity to receive funding to develop this project. And so we built a really neat partnership with our CMHA. And so I can't share too much about what's coming next, but we do have some more custom training coming from CMHA in partnership to support our students. Dun, 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 stay tuned. Next slide, we have accessible mental health services, super, super important, of course, hence our open door policy with our advising services, super proud of that. So where you can, knock down those barriers for access, think about that through your websites, where's the easy button for the students is always in the back of our minds. Responsive and obviously is connected with our community are our guiding principles, because that's just working within our model, which of course can and should work within yours as well. So we must be resourceful as a small college when encountering gaps in services. So we look for accessing the bursary for students with disabilities, to look access for counseling, for example. We've reached out to all of our local counselors who typically work with us and found their access points, which are now all moved virtual. So amazing stuff there. So there's plenty provincial, local, national programs, which I'm sure you're all aware of. And if you're not, I'd be happy to share along this slide. And then next slide. I'm almost done, guys. Crisis management. So, complications, conflicts, and crises. So we obviously have to be thinking about this even in our virtual world, and recognizing and responding that it's everyone's role. And so here we look to, and going back to our slide about, increasing our capacity. We have, like many of you here, already, systems in place to respond to these things, but now we're looking especially to develop our capacity to recognize, respond, and refer in the virtual world. We know it's different, so we have to look at it different. We have to think, feel, and act different. Absolutely. So there's a lot of opportunities here to observe. So I guess that's all I have to share for that. The next slide is something I like to share out to all of our faculties and our staff here at Northern College, because I think it applies whether you're working on or off campus in a virtual world, and helping you recognize. So I share this out. This is more of a person first perspective, so we can send this out to our students to review, and so that we open up a door for sharing and access to support. But I thought I'd bring this up, which was produced by the Mental Health Commission of Canada, a really easy model to recognize, changes, and that's ultimately what it's about, recognizing, what our baseline is, and noticing changes even in the virtual, and opening up the space for students to come forward with this information. I can put these into words because I see them here in front of me with what's going on in my life. So what do I do with that? And last but not least, our slide, I just wanted to put up, when I talk about all the various things that are out there, give you a visual. This helps me understand, because too often I hear, oh yes, there's not a lot out there, and access and da, 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 da. Not true. No, we have to stop with that attitude, and perhaps as a perspective or my opinion, but here it is, guys, right on your slide. All of these organizations, right from the government of Canada to your local campuses, have all kinds of goodies. Eat them up, they're there for you. And that's the end of my slide, or my show. So I hope I was able to offer you something, or maybe just validate what you already have going on. Thanks for your time, and I think I'm going to hand it over to Melissa.
Hello, thanks for the handover, Nicole. What amazing things you folks are doing at Northern. My name is Melissa Fernandez. I'm the Mental Health Programs Officer at U of T Engineering, so that's the University of Toronto's Faculty of Applied Science and Engineering. I use she, her, and they, them pronouns, so use whatever works. I'll usually respond to just about anything. And I want to let you know that I live and work on land that belongs to the Huron-Wendat, the Seneca, and the Mississaugas of the the Credit River. And yeah, I'm definitely grateful to have this opportunity. I'm also going to provide you with a visual description of me and what I'm wearing today, because it's important. So I'm a brown person. I've got asymmetrical curly hair. It's pretty good. I've been cutting it myself in the COVID season. And today I'm wearing an orange shirt. So I'm going to stand up. I don't know if you can see it, but I'll describe it. The reason I'm wearing an orange shirt today is because I am honoring Indigenous children who were sent away to residential schools. And I want to remember that there are still inequities that exist for Indigenous folks in Canada, especially when it comes to access to education. And actually, when Nicole said that there's a campus up in Moosonee, I was like, hey, I've lived in Moose Factory doing work around education in Indigenous communities. And so that was really neat to hear. But definitely, I want to remember this today. So for those of you who can't see on the call today, I want to say that this t-shirt that I'm wearing, it says Indigenous rights are human rights. And there's also a few emojis on the t-shirt. There's a solidarity fist, a heart, a lightning bolt, and on the shirt there's an illustrated image of the back of a person's head, and they're wearing beautiful long braids, and then the writing is on the back of their jacket, and it's underneath a Hiawatha belt. So thanks for letting me share that with you today. It's one of my favorite t-shirts. I don't just wear it on Orange Shirt Day. But I'm going to begin by telling you a little bit about the Faculty of Applied Science and Engineering. And you're welcome, Carly Webb. I'm going to begin by telling you a little bit about this place that I work. It's within the University of Toronto. I'm going to refer to it as U of T Engineering because that's what we call it over here. And I'm going to tell you that here at U of T Engineering, we have 8,000 students, so bigger than Northern. This includes undergraduate students, master's students, PhD students. Our student population makes up about 14% of the U of T St. George campus, but U of T has 3 campuses. There's the Scarborough campus, the U of T St. George campus, which is the downtown Toronto campus, and the Mississauga campus. And so we make up 9% of the entire university population. So 14% of the downtown campus, 9% of the entire population, i.e. U of T is huge. 65,000 if you're wondering. And so we are a very small piece of this place, but as you can tell, we do have a lot of students that we cover. In addition to that, we have 630 staff and faculty members. And so my role is to work within this faculty. I serve both undergraduate and graduate students, and I'm here to build capacity to support student mental health within this faculty. And so at times this involves program development and delivery, and this might be to staff, faculty, or students. Usually it's student leaders, to be very honest. Sometimes I liaise with other staff working in the faculty and outside the faculty. So I do liaise with like the academic advisors and the health and safety advisor. And I also liaise with people outside of U of T Engineering. So maybe within the arts and science faculty, or maybe in kinesiology, who might also be doing work like I'm doing, or maybe at a health and wellness center as well. I do chat with those folks, and I actually used to work in one of those places, in a couple of those places, actually. I'll tell you a little bit about that too. Yeah, so that's the nature of my work. I essentially am here to help faculty and also advocate on issues that we're recognizing that are impacting student well-being. And so I'm trying to make sure that student well-being is prioritized in my work. And so the role that I'm in, the mental health programs officer role, is a relatively new position within the faculty. And I have done the entirety of this role while we've been in the COVID pandemic remotely. Because I was not new to U of T or U of T Engineering, the transition wasn't that difficult. But I think that it also helped that I came to this work with a lot of other experience as well. So I came to this work with about 10 years of experience working across multiple universities and colleges. I've worked at McMaster, I've worked at Fleming College, and now I'm at U of T. And so I wanted to share that with you because I just wanted to just let you know where I'm coming from. And also if you have questions for me, I'm happy to share. I also want to share that I am the chair of the Ontario University College Health Association's health promotion arm or division. You might know it as OUCHA. And I'm sharing this with you because I want to let you know that this year OUCHA actually has free membership. So if that was a barrier for you, I'm going to put my email address in the chat. And if you want to get linked into the OUCHA Health Promoters community, definitely let me know and I'll connect you in. Also, I'm letting you know this because I probably am connected in with people on your campus who are doing health promotion work. If you don't know who that person is, and if you're trying to figure that out and having a hard time, reach out. I think I'm mostly just selling myself right now as a matchmaker, but I think CICMH also sells themselves as matchmakers. So that's okay. We're all here for you. We're in this together, and we can hook you up in all the ways that you need to be. Yeah, and I guess if you're outside of Ontario, we can definitely try to do that too. I think CICMH has some contacts. I do too through OCHA, so definitely reach out. So thank you for joining. I'm gonna, as Nicole alluded, I'm gonna concentrate a little bit more heavily on how did we support students in virtual classrooms with the shift that was caused by COVID-19 and the pandemic and online learning and all that. And so I'm going to jump right into it. So the reason that I'm focusing, Perlin, next slide. The reason that I'm focusing on our efforts within the learning environment is because we all know that, I think we all know and we all probably acknowledge that health is created and lived by people in the settings of their everyday life. This was something that came out through the Ottawa Charter back in what does that say, 1980 something. And so we've known this for a while now. People's health is shown where they live, they work, they play, they love, and obviously the virtual classrooms that are nicely situated within their homes are exactly that setting. And very honestly, in this context, it's the only touch point that our universities need to have with our students. The only place that students really need to go in order to succeed is their classroom. And I bet you that most students, some students will say they don't even need to go to their class to succeed. But let's just hope that that's the one place that we can guarantee that is one of the necessary touch points. And so, yeah, I thought I wanted to share with you some of the things that we're doing here. Yeah, I guess I should share that at U of T Engineering, we've made commitments to supporting mental wellness, to assisting students in need, and also promoting healthy lifestyles. And this has been written into our academic plan. And so this is coming from our core, which is why because it's been written into our academic plan, it's allowed us to actually write these pieces into the way that our programs are delivered within our classrooms and in our policies, and even the things that our dean is advocating for. And so that has been a really important shift. It has been written into our academic plan for the last few years, but I think that that's really what allowed us to leverage. We were able to leverage what we wrote into those academic plans to say, this is what we need right now. So in today's session, I am going to be sharing some of the best practices that we've encouraged our teaching staff and faculty to adopt as ways to support student mental health in the virtual classroom. And I'm also going to discuss what are some of the things that they're actually doing. The best practices that I'm going to be sharing are not my best practices. They're things that I've researched. They aren't things that I've researched. They're things that I've found that other people have researched. And so I need to give credit to a team over at UBC, and they call themselves UBC Wellness. And they are a collaborative team of researchers and student service staff who are at the University of British Columbia, and they've put together some awesome guides. And so I'm going to share some of those guides, but really I want you to go and download those guides because they're really great. And I'm going to also, what I've done with these guides is I've infused some of the Center for Innovation in Campus Mental Health tips as well, that are specific to online learning, because the UBC guide was not specific to online learning. They wrote that a couple years ago. And I've also been having conversations with U of T Engineering staff and faculty. And so they've also helped to contribute to this list of best practices that I'm going to share with you today. We can move on to the next slide, Perlin. So the team of researchers at the University of British Columbia used appreciative inquiry, and they investigated teaching practices that were positively influencing student well-being and They figured out, they categorized them, and then they developed a tool for educators that just essentially highlighted these best practices which promoted well-being. And as I said, these they weren't necessarily specific to online learning. And so that's where I took some other pieces and I brought them together. And I have included the reference to this work on this slide, and it's also in my references. So when Perlin puts the slides up, you can always go in and check out what those references are. I think that this should come into the PDF version, but you will be able to click on certain things in my presentation so that you can link to the right places. So overall, they found that there are 3 factors that enhance student well-being in the learning environment. The first was well-being is enhanced when a student experiences belonging and social inclusion through feeling connected to other students and their instructors. The second factor was well-being is supported when students are learning well, and this includes feeling motivated to learn and feeling that they were learning effectively. And then the third factor is that well-being was supported when the instructor recognized that the student's life extends beyond academics and considered the whole student. And so in the next slide, we're going to begin with the belonging and social inclusion piece of it. And so we all know that students with social support systems are more likely to seek help when they need it, and they're more likely to experience mental health balance and have positive physical health outcomes. And so definitely social inclusion plays a huge role in directly supporting student well-being. And so when a student feels included, it's obviously easier for them to achieve academic success, and in turn, they have a greater sense of well-being. And so the UBC wellness researchers found that feeling connected to the instructor motivates students to work harder in their course, and it makes it easier for the student to reach out for help when it's necessary. And when the instructor gets to know their students better, they're able to connect the course material into the students' interests, motivate them to learn, and then definitely having peer relationships in the classroom was also motivating for students to learn, attend, to keep them caught up, and also to motivate them to study outside of the class. And so this slide that you're looking at here has some practical tips from the UBC wellness researchers, from the Center for Innovation in Campus Mental Health, and also from some of your colleagues here at U of T. And so I'm not going to read through all of these because you are going to receive them in the slides, but I do want to just say quickly that these are color coded on the slide, and so when you are reading through them, the light blue ones mean that they are easier strategies to implement. The medium blue suggests that the strategy may require some preparation from the instructor, and then the blue one suggests that the practice may require thoughtful preparation from the instructor. And so I'm not going to read each one of these, but I am going to highlight on the next slide a couple of the practices that we have adopted here at U of T Engineering. And so the tip that I think you went 2 ahead, Perlin, 1 back, there we go. So the tip that I'd like to highlight from the fostering instructor-student relationships, so the first column, are the first and the last points. So having short informal conversations with students, and creating discussion boards, especially discussion boards on topics that are not at all or tangentially related to the course. And then obviously as an instructor participating in those discussion boards. And so in the online classroom context, these types of interactions, these like short conversations that we're used to having, like at the beginning or end of class or outside the class, those are much harder to have in our online setting. And so by doing things like, by doing things purposefully to try to foster this environment and create these environments is going to be needed. And so when we were talking to U of T engineering professors, one professor shared that he is posting discussions in his discussion boards that are not at all related to the course. So he has a book club thread going. He has, I think he has like a cooking conversation going. And these are just like random conversations in the middle of a calculus course that he's trying to engage his students with, so that it becomes less intimidating for them to actually reach out for help when they need it, so that the discussion boards aren't this unfamiliar place. And it's working. It really, really is working. Other things that we have encouraged our professors to do is consider opening up the class about 15 minutes earlier, so that you can foster like people talking in the discussion boards, or sorry, in the chat, or even on their cameras. One of our professors had in actually the largest course in first year, actually just has an open like Blackboard test course I guess a Blackboard Collaborate session. So it's almost like a Zoom session that students can just go into at any time. So it's a classroom setting and online that you can just go into, and you can see when there's other people in that class, and you can ask them your questions. So this allows for a casual, neutral, drop-in type space that is course specific. And I think that it's really working there. But really, our discussion boards are where it's at, I think, right now. Another tip that I wanted to highlight, so that's in the second column in the peer-to-peer piece, is creating a peer mentoring program in your course. And Perlin, on the next slide, there is a slide about a study buddy program. And this was done by Professor Elham Marzi. So she is one of the professors here at the Faculty of Applied Science and Engineering. And she supported students in establishing a connection with at least one other person in the class. So she made it as she made a robust program to be able to do this within her class. And through these connections, what she was hoping for was, she was hoping that students would check in with each other, that they would commiserate together, that they would support each other, that they would inquire together, that they would also work together for non-graded active learning pieces, and that they would also help each other to improve the quality of their work. And what Professor Marzi found was that when she did this, it actually increased positive student performance in the class. And so she was able to say, this is something that I want to keep going through the years now. It's not just something that she's going to do in online classes. She's made a commitment to doing it, even if and when, maybe it's when, we go back to in-person classes. There is a link on the slide where the hand is, and when the slides are posted, if you want to learn more about Professor Marzi's program, click on that hand and it'll take you to a blog post that will tell you all about it. On the next slide, I'm going to get into the second part, or the second factor of what enhances student well-being in the learning environment. And so this is the learning well component. So UBC's wellness researchers showed that student well-being is supported when students feel motivated to learn, and when they feel that they're actually learning effectively. And so once again, I have a list of some of the tips that UBC shared, and infused it with some of the campus mental health and U of T specific things. And so Perlin, that's on the next slide. Actually, if you can go 2 slides, that would be good. And so, oh, no, 1 back. There we go. And so here are some of the tips that that fall into this living well area. And so they're on this slide. There's some around helping students find value in the subject matter, and then there's others around helping students find value in the learning process. And so the 2 tips that I wanted to highlight from these sections are connecting concepts to the real world and encouraging students to ask questions. And there's lots of different ways that students can ask questions in our online forums. So using the chat, the mic, the polling features, etc. And so I think that this piece around connecting course concepts, connecting course concepts to the real world is something that actually happens quite naturally within an engineering discipline. And so what I want to stress is the fact that what we should be stressing in our classrooms right now is our current context, our context of being in a global pandemic. And I have been challenging instructors to bring aspects of the global pandemic into their classrooms. And I do this because by bringing it in, what they're going to be doing is they're acknowledging COVID-19. It allows students to think and talk about what's going on in the world right now. And for engineers, it allows them to be problem solvers for this problem, something that they're really good at doing. And what they also are able to do by doing this is they're able to squeeze in some health promoting education into it. So I'll give you an example of how this happened. So I attended a lecture back in March, so at the beginning of the pandemic, and it was for a design course. And the professor was discussing the importance of user experience and the importance of like consulting the user and the people who are going to use the product before and as you're making the product, so in the design process. And he was doing this by showcasing different mask designs. And this was one of the first times that I had actually seen a variety of different like head straps and ear loops and all these things that I never thought about in a mask because it was the beginning of the pandemic. And so he was talking about all these things and talking about the user experience behind it. And I found myself that when I was shopping for masks, that I was thinking back to that lecture. I was thinking about, oh, what kind of ear loops do I want? Oh, is it the behind the head feature? What do I want to get? And I ultimately ended up choosing a mask or masks, because you need more than one. I ultimately ended up choosing masks that I knew I was going to be able to wear comfortably through the day. And it was because of this design lecture that I ended up sitting in on. And so inadvertently, by teaching the principles of design, and by infusing mask design into his course, this professor taught a health promotion tip around how to keep your mask on by choosing the right kind of mask, right? And I thought it was brilliant. And I think that we should be doing more of this. The second strategy that I wanted to highlight on this page is encouraging students to ask questions in multiple ways. And yeah, the tech capabilities of our classrooms now allow us to do this. But as Perlin's going to show you on the next slide, sometimes with all these new ways to ask questions, it brings up a universal design challenge in some ways. And so Perlin, if you can just go on to the next slide, so here we go. Here we have a Teams message that I screenshot from a thread that I'm in, and it's from an instructor. And it says 730 attendees with 400 unique comments and questions. And you can imagine that this instructor was sharing this because they were feeling a bit overwhelmed by all the questions that are coming in. And I don't blame them. I wouldn't want to be answering 400 unique comments and questions. But I'm also really excited because what this means is that, hey, we have finally achieved something close to universal design, because I've sat in on large lectures. I've sat in on this exact class actually, and there was never 400 questions being asked. At most, there was 4 questions being asked, which means that 4 people got to engage in the conversation. And so the fact that questions are being asked is a good thing. But the situation that we're now in obviously puts a strain on faculty and teaching resources. And yes, it will be emailed. I don't think it'll be emailed to you. Maybe Perlin will clarify that in the chat, but they will be sent out in some way. So yeah, so the asking questions is great, but puts a strain on teaching staff and faculty. And so what we need to do is we need to find ways to support teaching staff and faculty, and supporting them in the engagement in the online classes, but also in the development of asynchronous content to make our asynchronous content as good as our synchronous content. Because really what we know is that now a lot of professors are feeling like they're teaching 2 courses because they have to develop a synchronous version and an asynchronous version. At least that's the case here at U of T. And so I think what we really need right now is some support. Moving on to the next slide. So I'm going to continue on with some of these tips. Perlin, do you want me to wrap this up quickly, and so that it allows for, like, we're pretty far on time, I think.
I feel like I should have budgeted 1.5 hours for this. Like, it's such great content. Let me ask Michelle, do you think you'd be able to, I mean, actually not just Michelle, but if everyone's able to stay just for maybe until, let's say 2:15, then that way we'll hopefully actually be able to get everyone's content in, because I don't want things to get lost.
Sure. I guess my only question is, did anyone have questions for so far, because I know some people may have to leave at 2 o'clock. So also wanted to leave space for that as well.
Well, if people have questions, please feel free to put them into the chat. But otherwise, yeah, Melissa, if you wanted to maybe start to wrap up, and then we'll take questions, and then we'll go to Michelle. Maybe that makes sense.
Yeah. So I
Yeah.
guess I'll just quickly highlight some of the other things that we're up to. So in some of the other categories, so we always have shared suggested syllabus statements, and so I've included the suggested syllabus statements that we put into our courses this year. It's not mandated that these are in our courses, but we do encourage instructors, and so I'm always going to encourage you to put syllabus statements out there that will help you to push along messages of mental health supports and accommodation supports and inclusivity. Some other things that we are up to is that we're trying to incorporate active learning into our asynchronous classes, and that can be pretty difficult, but it's not impossible. And actually I did this by designing a course within our online learning management learning management software. And it was pretty easy to do, and it allowed our students who are TAs to go through a course where they could identify, assist, and refer, and they got to put those skills in use through like a case study format, and it was really helpful. And we've also adopted Living Work Start here, and so we offer Living Work Start, which is a suicide prevention training that's from Living Works. We offer that to students here and staff and faculty. It's for free. We've had 100 students at engineering uptake on that, and it's been really, really helpful. And what they do is like you can actually record yourself asking someone if they're like not a real person, but asking the computer like if they're thinking about suicide, and you can hear what your voice sounds like in that. So it's a really great tool, and there are ways to incorporate active learning into our courses. Some of the other things that we're doing is that we're also being really transparent with students about the fact that this pandemic does impact our mental health. And I think that this message is coming really clearly from our dean, and that's been really important. So if you want to follow someone new on Instagram, follow at UFTEngDean, and this is the official account of our dean, and he posts about like the ways that he's taking care of his mental health by running and by cooking and doing all these things, and he talks about like the ways that he like has to deal with the pandemic. And I think that what this does is it makes it real for students to feel that way as well. When he's put out statements around like how he empathizes with Black communities right now, and how anti-Black racism is not allowed here at U of T Engineering. And so he really is staying current, and he is allowing students to feel. And I think that that's been so important. And so I think I'm going to end it on that. And if you want to know a little bit more about what we're up to, check out the slides. And I've also included a web page that you can see some of the other things that we've been doing.
All right, thanks so much, Melissa. And sorry about that, folks. I really should have budgeted like an hour and a half for this, I think, because there's so much amazing stuff that you have to share. So I guess before we go to Michelle, we did have one question that came in. Sorry, just opening that up. Where's my Q&A? Yes. We have a question from Stephen Sutherland. With people feeling the infodemic, what have been your strategies for getting information out to students other than email?
I've been doing a mental health roundup email. So I've been sending our communication specialists a weekly email of all the things that I think are important in the realm of mental health. And our communication specialist then will decide where and how to put that out. And so I think a lot of the messages are actually going out on social media and through like Instagram and Twitter and Facebook and that kind of stuff. I think it's mostly Instagram though.
Awesome. Thank you, Melissa. Okay. And Michelle, you know what? We don't have any other questions, so would you like to go ahead?
Sure, sure. And I will try and keep it brief. I also have the tendency to wander, but
You know what? I honestly, it doesn't matter. I think, I think there's so much. Again, there's so much great content here that if people can't stay, that's fine. But this is being recorded and it's gonna be posted online as well. So go for as long as you want.
Okay. Oh, you might regret saying that, but I will still try and keep it. I'll try and keep it a bit more succinct. So thanks for the invite, Perlin, to come in and speak a bit about what Centennial is doing to address student concerns and the student experience right now during COVID-19. My name is Michelle Urish. As I said before, I am the manager for student experience and ethics at Centennial. So my role encompasses a lot of different things, which I will sort of try and weave in. But I did want to start by sort of setting the stage for, in terms of how we are looking at this pandemic. I know for a lot of times COVID-19 has been characterized as an equalizer. So the idea being that no one's safe from COVID because there's no vaccine created yet. And we're all sort of going through the same mandatory quarantine and the restrictions that have been imposed on whole cities, provinces, and indeed different sectors. While it is true that we're all in the same boat, as it were, by virtue and that COVID-19 has created this sort of sense of disequilibrium, it's never been an equalizer, especially in the post-secondary sector. COVID does discriminate, and it has an effect of further marginalizing those who are already facing marginalization and magnifying the inequities that many students face. It makes certain barriers higher, and it's also surfacing barriers that weren't there previously for students. That said, the pandemic has also presented us with a lot of opportunities and opportunities to implement new solutions and push through projects and initiatives and solutions to address some of our systemic and more wide-scale issues without going through layers of, I would say, bureaucracy, but also layers of proposal and approval processes. We've very quickly been able to push through upgrades to our tech infrastructure so that we can actually handle online learning, which has been great. And I think the key thing, the key opportunity that this pandemic has presented is for giving us the opportunity and the ability to focus our efforts on things that matter. And I say that as someone working in student services, and a lot of times we're often thinking of, what new program or new initiative can we implement? How can we make things bigger, better, and do more? But right now, I think the focus is on doing things that matter and that are going to have an impact on the student experience and student success as we all navigate some very new and unique times. I think this pandemic has also given us license and a mandate to get creative. It's forcing us to be more responsive than we have been. We need to be because the landscape is ever changing, information is ever changing, and new things are coming out. And it really requires us to be nimble. It's forced us to find new ways to maintain connection in an online environment and to use new channels to intentionally foster connections. So while there have been a lot of stressors and solutioning that we've needed to do, I think it's also given us an opportunity to really rethink what's important and how to provide support that really matters in times like this. So I think we can go on to the next slide here. So I just wanted to share a little bit about some of the work that my office, which is the Student Experience Office, has been doing, and along with some of my other partners in student services here at Centennial, to share some of the things that we've been doing over the past 6 months that we've found have been working. And all of that to say that, based on what Nicole was presenting, it's not very different from what every institution is doing. So By no means our programs and strategies quite that unique. It's sort of reassuring in that way to see that everyone has the same like really great ideas and that it's resonating with both students and staff alike. So just to give you a bit more information about our context here at Centennial and my role, the Student Experience Office is a student-focused hub, a centralized hub that supports student persistence. So we have a team of normally 2 student experience advisors. Right now we're down to 1 because one individual just left yesterday. So we have 1 student experience advisor currently, me as the manager, and then we get support from an admin assistant who's affiliated with our advising and pathways team. So our office helps students to navigate the college system. We help coordinate linkages to other services and departments and resolve complaints or to address student needs. Some of those needs which may not be met by our current system. So that's the case management piece of what we do. We also help foster a sense of self-efficacy in students and do skill building through our conduct processes and conflict resolution processes. With a restorative justice developmental lens. We deliver co-curricular programming to students on various topics, ranging from student rights and responsibilities, bystander intervention training, and then for staff on topics ranging from classroom management, conflict resolution, that's for students primarily, and for staff identifying and responding to students in distress. I'm also an assist trainer, so these are some of the kinds of training and workshops that we offer as well. And our office, as I alluded to, we're the primary access point for our referrals of students of concern and students at risk to our multidisciplinary case management team. So our office of 3 or 4, now 3, serves the entire Centennial community. So at full strength, we have about usually around 26,000 full-time students, 19,000 part-time students spread across 5 campuses and multiple satellite sites in the GTA. And when COVID hit, it hit at a pretty interesting time. I was on vacation and one of my staff was also on vacation. So our office basically had 1 person. Plus an admin support person. And when I rolled in, I was able to go to work on Friday the 13th. That's the first day I was back. And by the time I drove home, the city announced that anyone who'd recently traveled had to go into a mandatory 14-day self-isolation and quarantine. So, and then within 2 days, I think on the Tuesday, March 17th, that's when our college shut down the physical campuses. So everyone ended up working remote. And so that really forced us to do a hard pivot into figuring out how we were going to transition our services remotely. But I feel that the transition for us was relatively easy, given that we were already used to working with students across multiple campuses and having to do a lot of our contacts with students, at least initially by phone and email. And so for us, that was relatively easy, and it forced us into doing some early planning around what would our services look like when we moved online, and where we could focus our efforts to have the biggest impact for students. So we really just looked at the multiple roles, the multiple hats that we wear, and identify that right now the primary need would be for navigation, helping students navigate what was going on and providing information. So we focused on developing tip sheets and resources for students and staff to help them with the shift to learning at a distance. So we produced tip sheets around rights and responsibilities in an online learning environment. We did a rebrand on our identifying and responding to students in distress, rebranded it as Recognize, Respond, Connect, which really helped staff to figure out the new touch points for when they were noticing students maybe experiencing distress online, what it looks like in an online environment, and then how to connect them, because we were really used to, our resources previously had all of the office extensions, but a lot of our services moved to sort of email as the initial contact point, or more centralized phone numbers, as opposed to having like one phone number for a service across every campus, meaning that there were 4 numbers depending on what campus you're affiliated with. A lot of them just sort of reverted to like one general line number. So it was also helping both staff and students sort of navigate the new contact points for support across all of our services. We became part of a newly formed student issues communication and service model team, which focused on developing and disseminating clear, coordinated information to students and staff, and also looking at a new service plan for student services as we move through each of the phases of reopening. And then we also focused on looking at some of the key policies and procedures in the institution, and making sure that they were up to date, and also that our processes weren't creating further barriers. So IT acceptable use policy, our student code of conduct, disruptive behavior in the classroom, online learning environments, harassment and discrimination, and our complaint process are some of the areas that we were looking at. And I think we can probably go to the next slide. So this is just some examples of some of the resources that we've created for students and staff. The last image there is actually of a co-curricular module that we created with some of our partners in different areas of student services. So this was a way for us, instead of delivering content in person, we wanted to have a way to help orient students to key areas of learning development. It should be launching soon. We actually finished it early September, but now we're doing testing with students. And the areas that are covered by these co-curricular modules include sort of transition to the college, leadership development, equity and inclusion, conflict resolution, which is the area my office focused on, and career preparation. So that's been one way for us to be able to deliver our co-curricular programming without requiring us to host webinars or to do those presentations for each class upon request. It was also a way for us to be able to just sort of disseminate that information without requiring our team of 2 to be doing multiple sessions. And we can go to the next slide. So I just wanted to give some examples of effective practices from some of our other student services teams. So for our advising team, something that they had done before, but a little bit differently for COVID, were pre-arrival virtual advising sessions. And we found that this has been really effective. So new students get a personalized invitation to sign up for one of 12 sessions that are run on Zoom. And the goal of the session is to help them to, start to build connections, community, and capacity through, just introducing themselves to each other, getting to know who their success advisors are, and then walking them through some of the key systems and technology that they'd be using for their online courses, and letting them know about some of the support services that are offered virtually. There were, and I guess something to note, which is probably the same at a lot of institutions, that a lot of our students are actually studying remotely from their home countries as well. So this is a session that was attended by, for the 12 sessions, over 800 students participated from all over the world. And so it was really, that was really great that there was such a huge uptake with that. Given the different time zones, they tried to time the session so it would, students participating from different time zones at least would be able to attend a session in a time zone that was relatively worked for them. And then we can go to the next slide. And these are just examples of some of the other services and programs being offered through our other teams to improve the student experience and address student well-being during this time of disruption. So these are examples of the services that people have been finding are the most effective in what they've done. I wanted to give a shout out to our athletics and recreation team, because with the closure of all of the facilities, they were probably one of the first ones to go online and create, their YouTube fitness channel. So, providing fitness classes that were open to both students and staff online, and very quickly just found ways to try and connect students and staff and engage in wellness at a time when everyone was really shut in. Maybe I'll just speak to a few of the ones that don't have any hyperlinks here. So if you wanted to learn more about some of the programs that we're offering, all the hyperlinks will take you to pages for those respective services, which will tell you a bit more. But I also wanted to highlight one of them here, which is the friendship space. So this is from our community outreach team. We, at each of some of our campuses, we had physical friendship spaces that were started by the Indigenous traditionalists along with the college about 5 years ago. And with the move to online, the community outreach office really wanted to find a way to maintain those connections that they had that they built with students over the years, particularly students who've had to overcome a lot of systemic, racial, cultural, and economic barriers just to get to college. And so I'm really excited to see what this virtual friendship space will morph into. It's open during the regular business hours, and there's always someone from the office there online. Throughout the day, students can identify who's there. They can sort of step into the space if they need help connecting, asking questions, getting referrals, connecting with the staff there. They've created channels for Indigenous students, students who've graduated from our HYPE program, which is helping youth pursue education, women in STEM and skilled trades, student parents, and caregivers. So they've created these different channels on Microsoft Teams where students can seek to connect both to other students. They post different content daily, and students are always able to reach out and connect with a staff member for a video chat or something else. So like these are some of the ways that some of our services have really tried to pivot into finding new ways to support and connect with students. And yeah, maybe I'll leave it at there for that and probably go to the next slide. So I'm sort of in the wrap up phase here, but what's been working for us? I think I've been really amazed at how our teams have pivoted through this time, and really thought intentionally about how they deliver their services, what they deliver, how to do it in different ways, and how to not necessarily expand beyond the scope of what they're supposed to do, but to reimagine it and really think about, at the core, what their service is all about and what they're trying to accomplish, and then think about ways to do that for students, and to just because we're all in this together to sort of find ways to have more synergies with other areas of student services to ensure student success. As we move into through this semester and into winter 2021 and beyond, what we're trying to focus on is continuing to find ways of doing things that will work in this sort of high flex scenario or context that we find ourselves in. So for our team, what we've really been focusing on is this is probably, the pandemic was the first time we actually sat down and really thought about our response time and made a commitment that regardless of what happened, no student who contacted us would wait more than 48 hours for a response. We've far surpassed that. If students contact us, it's usually same day, next day response if they contact us after business hours. And the biggest feedback that we've had from students is that they're really surprised that if they call, we pick up the phone, or that they get a response so quickly. And but we've only been able to do this because so many of our other service areas have really picked up the load and helped us out, given that we are such a small team. the things for us that have been really effective are focusing on providing information to students and help filling those information gaps. And then as a team, it's really been having more frequent team touch points. So we meet about 3 times a week for like 15 minutes in the morning. Plus we have our case discussions meetings every other week and our team meetings every other week. So pretty much in a given week, we're meeting 4 to 5 times in the week. And I think that's helped us to really just connect with each other and try and share the load as much as we can, so that not any one of us feels that we're taking on a lot. And again, we've always been highly collaborative, but really relying on some of our usual partners, like our security investigations team, the international department, advising pathways, and now working more closely with other offices like community outreach, enrollment services, and even accounts receivable has been huge. And for our co-curricular programming, I think we were supposed to deliver about 26 workshops over the next 2 months, which is now really challenging given that we only have 1 student experience advisor left in me. So our Leadership Academy team have really stepped in to help us out to deliver content around conflict resolution to students in our aviation programs and our School of Communications, Media Arts and Design, semester 1 seminar courses that they've developed. And we're also working with the School of Hospitality, Tourism and Culinary Arts to integrating some of our content into the work integrated learning career prep classes. So that's been really, really great, and really so much appreciate the help of everyone just sort of pitching in. For our Calcs team, one of the practices that I want to highlight from them that I actually have really been thinking about and think this is sort of the way of the future for us. We were thinking about equity and representation. So they've moved to online scheduling for appointments. Students can get sort of same day intake, walk-in appointments if needed. But they've decided to actually start posting photos, the photos and bios for each of the counselors in the office, and students can actually select who they want to see. So it's just another way that makes it a little bit easier for students to work with or find someone who they see themselves in, or who I guess representative of their own identities, and I think that's really key. And for our office too, we're working on redesigning our website and really thinking of having the headshots of each of our team members on there, so that students, especially because we deal with a lot of complaints and harassment and discrimination complaints that come through the college, this is a way for the students to know who they're going to be working with or reaching out to. So yeah, so that's been a key and core practice I think that we'll continue to do. And then for our advising services, we implemented like a virtual registration queue, and they're doing virtual advising using Teams and Zoom. So they've managed to narrow it down to those 2 platforms, and really getting a lot of mileage out of that. And finally, I'm just in terms of the opportunities, I think some of the key learnings for us for this time, maybe we can go to the next slide there, is the things that I really see as the opportunities now are for us to remember the human in all of this, and to be human and to show care. I think this is the biggest thing that we can do, and I think that's the thing that students remember. So no matter what mistakes we make, no matter what misinformation or lack of information there is, or uncertainty, the fact that we are able to show caring and to be caring and to really think about the other experiences that they have outside of school, and really work to support them. I think that's probably what they're going to remember most. Maintaining connection, being a presence, reaching out, sharing our stories and sharing what we're doing, sharing information is really key, a really key opportunity during this time to really think about that, and building capacity. So this sort of speaks to what Nicole was talking about as well. So looking at coordinating our responses, and as we move out of crisis mode and are looking at starting to bring more of our services and supports online, how do we translate that to an online context, and how do we help staff and other partners sort of transition from that face-to-face to this online virtual world in terms of how our supports and services look like for them. Everyone's adjusting, and so as much as we can do to help build capacity for everyone, I think it'll lighten the load all around. We have to find ways to do, or we have to think about whether we need to do more with less, because that's sort of the reality. Might be smaller budgets, less staff, less resources, and less flexibility in terms of whether we're offering, like how we offer our services. Most of it is virtual. So like, how creative can you get with doing things online or virtually? Like, it only goes so far, but we do have to be creative that way. And then also, I would say, find ways to do less, right? So part of that is by sharing a little, collaborating with others, and finding those synergies and ways for us to work together, and being able to anticipate and forecast and contingency plan, but not to overcome, because we don't necessarily know what's always coming down the road. So maintaining that ability to be nimble and responsive and creative. So so that's it. I think that's where we are right now, and I'd really be interested to see, in another 6 months, what we're doing and what's stuck from this time, what we've been able to really do and implement that is going to change our system for the better, and remove even more barriers for students, and sort of just make education a more equitable experience for everybody. Thank you. That's it. And these are just some resources. Sorry, Perlin. These are just some of the resources that we've created for students online. So we have a student information center, some resource page, community resources page, where we pull together a lot of resources that students can access anywhere in Canada, pretty much. So we try to not keep it so specific to the GTA or the areas right around our school, recognizing that students may be studying in different places. So trying to pull together resources and search engines and things that can connect them to resources in their local communities, and an online learning toolkit to help students better navigate the world of online learning. So thanks for sticking around, for those who are able to stay, and yeah, I'll turn it over to Berlin.
Thanks so much, Michelle, and thank you so much, all of you, for sharing all your knowledge and your lessons with us. And I apologize that we did run over a lot, but I didn't want any of the information to get lost, because I really feel like it's worth sharing. So with that, we have a question from our audience. So I guess just open it up to anyone who would like to take it. Actually, let me just close the slides first so we can see everyone. Have any of you partnered with your campus libraries on any wellness initiatives or activities? My role is inclusion librarian, and I'm really interested in mental health and wellness issues and ways to support our students. Melissa.
So we have an engineering specific library, and so they usually run wellness related things in their library. So we have like worked together in person. Now online we haven't, but we do still maintain a relationship. And we do work on similar committees together. So that is the extent of our relationship right now. We are promoting things that are happening at libraries across U of T though. So for example, at one point in the pandemic, they were opening up libraries for internet use. And so that was something that like we then very heavily promoted. So in that way, we do promote, but we haven't been doing like collaboration where we're both like in a meeting deciding what to do, what program to roll out, and then rolling it out.
just to add, I think, being that libraries are, the source of information, an information hub on our campuses, not that we have any specific strategies, but we do, like Melissa suggests, and maintain that relationship. And our library houses a lot of information, so it's sort of duplicated in their hub of information with regard to resources inclusive of mental health. Resources and where to go. They have a button on their webpage that is very different and more progressive than ours in terms of Ask a Librarian. So are often a really, a first time, connection for students for accessing supports and resources. So they're always sure to touch base with us to find out, what's new, what's going on. They grab information from our web pages. And then even physically, we, when we were on campus, we're sure to bring in, all the relevant pamphlets for their seating areas and with regard to resources and support. But I mean, your question just strikes some food for thought. So thank you for that. There are some opportunities there.
And for me, like my team right now, we've sort of stepped back from that work a little. We have a Thrive initiative, Thriving at Centennial, and I know libraries and our Center for Accessible Learning Counseling Services, they partner a lot around different initiatives. So definitely there is a lot of that kind of programming going on and being developed and running right now. And we're also working a lot with the Center for Global Citizenship, Education and Inclusion. So those three teams, plus our team to a certain extent, we'll work really closely together on different initiatives. So it's definitely work that is happening, and really just trying to find ways to incorporate wellness into like various aspects, right, of anything we're doing. So even when we're planning and looking at, I guess one thing that we had, tried to support students who contacted us who were really looking at wanting to have sort of drop-down spaces, study spaces on campus, even with the closure. And so really working with the library team to look at ways that we could facilitate that, even as we're closed, and a lot of that has been taken up by the broader committees that are looking at reopening as well. And I'm really happy to say that a lot of those wellness considerations have really made their way into our reopening plans with respect to our library services, which is one of the two besides the bookstore that are really sort of going strong on campus right now, even though we're primarily in an online service delivery mode.
Michelle, and thank you all for sharing your thoughts on that. We don't have any further questions, so I think last thing is before we perhaps wind up for the day, did any of you have any final thoughts?
I wanted to just touch on something that was mentioned in the chat, the Together All resource. It is a great resource. You might have known it before as Big White Wall. So they've just gone through a rebranding of their name and the way that they like are branded. I guess that's what rebranding means. And so yeah, so that is the same resource, and it is a great resource. It's free. It's funded by the Ontario government for anyone who's 16 years or older, and it is a peer-to-peer mental health based like forum and chat board sort of place that is moderated by clinical professionals.
Awesome. Thanks, Melissa.
I just wanted to say thank you all, especially to those who stayed the duration, an hour and a half and beyond now. And to, I guess, be kind to yourselves and recognize, with a fluid situation. So as you're planning and progress, so always keep that in mind.
Thanks, Nicole. All right, and with that, if nobody else has anything else they'd like to add, I just want to thank all of you again for the wonderful work that you do and continue to do, and also for staying here for an hour and a half and beyond, as Nicole said. Usually I would say I'll see you again soon, but this is my last day, so I won't be seeing you, unfortunately. But it's been wonderful working with all of you, and take care.
Good luck, Berlin.
Yeah, good luck. Thanks for everything you've done.
Yeah.
Thank you all.
We'll miss you.
I will miss you guys. So, and with that, goodbye. Take care. Have a lovely rest of the day.
Bye, everyone.